2 weeks after the United States secured a deal with Moderna and Pfizer to supply enough vaccines for all Americans, Johnson & Johnson announced it can provide 20 million doses by the end of March. The pharmaceutical giant is seeking FDA emergency use authorization, provided that 20 million dose figure ahead of a congressional hearing today on the nation's supply of vaccines. So far, the United States has 600 million vaccines secured with Pfizer and Moderna. Johnson & Johnson plans to provide 100 million vaccines to the U.S. government by the end of June and 1 billion globally by the end of this year. The House Budget Committee, meanwhile, approved the Democrats' $1.9 trillion aid bill yesterday in a 1916 vote. It sets the stage for a potential House floor vote as early as Friday, potential Senate vote next week. Joining us now, Chairman of the Judiciary Committee, Democratic Majority Whip Senator Dick Durbin of Illinois. Senator Durbin, good to see you this morning. Let's start there with the COVID relief bill. What is the state of the bill right now? It enjoys broad national support. 72% in some recent polling of Americans support the $1.9 trillion package. Are you going to get it through, and will you have to use reconciliation to do it?
Well, Willie, let me remind you that the first CARES Act in March of last year had 96-0 vote in the Senate.
Yep.
That the December version of this bill, which came down to a lower level, $900 billion, had 92 votes in support of it. And now we're looking around for Republicans who will step up and join us for the next bipartisan effort. We definitely need them, and we certainly need this relief going to the American people. More money for vaccines, more money for distribution, cash payment of $1,400 to many Americans who are desperately in need of it, making sure that the unemployment benefits don't run out in the middle of March, providing money for rental assistance so people are not evicted. This is an emergency measure that President Biden has sent us. We need the same level of bipartisan support that we gave during the Trump administration.
Senator Durbin, good morning. It's Casey Hunt. If the minimum wage hike to $15 an hour is included in this bill, and it's going to be in the House version that they send over, I know you're waiting on a ruling from the parliamentarian, but if she says, if the parliamentarian says okay, is Joe Manchin going to vote for this package if it includes the minimum wage? He's expressed concerns about it.
Casey has expressed concerns. I'll let Joe address his vote directly. But I think we need to be, I support it as it passed the House. I'd like to see it pass the Senate in the same form.
But when you're counting the votes, do you think he can get it passed?
Well, that's the key question, of course. In a 50-50 Senate, one senator makes a difference. So I don't want to suggest that Joe has decided to vote against it. I don't think he's made that announcement, but I know he's thinking about it long and hard. I hope that he does support it. We need him.
And Senator, do you think in the event that this is excluded, the minimum wage piece of it, which seems to be very problematic across the board for Republicans as well, do you think you can get some Republican support for a package this big? I mean, Senator McConnell has said it's not targeted enough, it's too broad, but there are, of course, moderates, Mitt Romney, Lisa Murkowski, Susan Collins, who may potentially be willing to get on board. What are you hearing from them right now?
Well, I am hearing positive things. I sit in on the group, the bipartisan Senate group that Joe Manchin has convened, along with Susan Collins. I hear positive things about issues. I haven't heard a commitment to $1.9 trillion. They have suggested some modifications. Some, I believe, are in the area of reality, possibility, but others may not be. So we need to sit down and get this negotiated, and we have to do it in the context that this money is needed and needed now.
Senator Eddie Glaude has a question for you. Eddie?
Senator Durbin, great to see you this morning. I want to ask a question about the COVID relief bill and those communities that are disproportionately impacted by COVID-19. What aspects, can you explain to the American people, what aspects of the COVID relief bill will directly address, right, those communities that are in some ways in the front lines of the devastation of COVID-19, black and brown communities and resource-deprived communities, poor communities?
Well, there are a variety of things. One of the measures that I've included would put more money into the National Health Service Corps so we have more doctors and medical professionals in those communities. There are also provisions in there to create incentives for care to be given in these communities. We know that these are a high priority, and I've got to be very candid with you. When I talk to leaders in the community, they still say there's a hesitancy, a resistance to the whole idea. The first injection of a vaccine in the Chicago Chicagoland area was an African-American hospital worker, and she had to be persuaded. And once she went forward, the entire staff joined her. 90% of them joined her over the following weeks. But there is a persuasion element here that goes into the equation.
Hey, thanks so much for watching our YouTube channel. You can follow up on today's top stories and breaking news, or catch up on your favorite MSNBC shows all in one place. Download the NBC News app today.